Hello, I'm Dr. Neelima Kale. I'm a family physician with the Ohio Medical Group in Westlake and Rocky River. Today I will talk to you about preventive health care for women. We will talk about screening tests that are recommended for women at different ages. Screening tests are tests done to either catch a disease in early stages or prevent the development of a disease. The United States Preventive Services Task Force is a national body comprised of physicians of various specialties who make the appropriate recommendations. There have been some recent changes in these recommendations which have caused questions and confusion in the minds of some women. So today we'll go over a brief summary of what available tests are and their appropriate timing. The most common test is a test for breast cancer called a mammogram. A mammogram is an X-ray picture of the breast. Screening mammograms are used to check for breast cancer in women who have no signs or symptoms of the disease. The National Cancer Institute recommends that women ages 40 or older have a mammogram done at least every 1 to 2 years. Women who have a family history of breast cancer and first-degree relatives, women who carry certain genes that increase the risk for breast cancer, and women who are on long-term hormone replacement therapy during menopause are some groups of women who will need more frequent screening. Ask your physician what is the most appropriate screening interval for mammography for you. Cervical cancer and screening for cervical cancer using pap smears is the second most common test done for women. Women used to be advised to get a pap smear every year after becoming sexually active. That recommendation has changed. Current recommendations are for women between 21 and 65 years of age to get a pap smear every 1 to 3 years. Ask your physician what is an appropriate screening interval for you. If you are older than 65, you have never had an abnormal pap smear, or if you've had an hysterectomy for a non-cancer reason, you most likely will not need a pap smear. Again, ask your physician. Screening for colon cancer is the next most common screening test. Every woman should get a screening test for colon cancer at the age of 50 and every 5 to 10 years after that. Various kinds of tests are available. Colonoscopy and stool studies for colon cancer are the most common tests. Other screening tests include screening for depression. Your emotional health is as important as your physical health. Talk to your physician about being screened for depression, especially if you feel sad or hopeless, or you feel like you're taking less interest in things that used to previously excite you. Diabetes or high blood sugar is also a very common condition in the United States population. Everybody should be screened for diabetes, but women who are overweight or obese, women who have high blood pressure, and women who have a strong family history of diabetes, women who have given birth to very large babies, 9 pounds or over, or women who had diabetes during pregnancy are at increased risk and should be screened at least annually or every 2 years. Screening for high blood pressure is recommended to start at age 18. Starting at age 18, have your blood pressure checked at least every 2 years in a doctor's office. High blood pressure can cause stroke, heart attack, kidney, and eye problems, but if caught and treated early, will allow you to lead a normal life with no complications. Cholesterol screening is also recommended. Cholesterol screening can begin as early as age 20, depending on your personal and family history. Ask your physician for a cholesterol test if you smoke, if you're overweight, if you have diabetes or high blood pressure, if you have a personal history of heart disease or blocked arteries in your heart. If any man in your family had a heart attack before the age of 50 or any woman before the age of 60, you must inform your physician and get screened for high cholesterol. Osteoporosis or bone thinning is another condition that can be screened for, and if caught early can be prevented. Ask for a screening test for osteoporosis approximately 5 years after menopause or at the age of 65 to make sure your bones are strong. If you are younger than that, but you have a very strong history of osteoporosis, if any female relative in your family had the typical dowager's hump, please ask your physician when and how often you should be screened. Finally, let's talk about immunizations. Get a flu shot every year. If you're over the age of 65, get a pneumonia shot. Patients with conditions such as diabetes, asthma, emphysema need a pneumonia shot at a younger age. Also ask your physician about getting a shot to prevent whooping cough, which is unfortunately coming back in the United States, and also to prevent shingles if you've had chickenpox as a child. I think that's a lot of information for today, but what is more important is that you have a dialogue with your physician about what is the most appropriate screening regimen for you. Thank you.